Happy Friday, everybody. Welcome to the internet's favorite show about plastic surgery, health, and beauty. This is Nip Talk. Today, first off, breast implant capsules. What are they and how do you manage them? We're going to go over all of that with you. Then, H1N1, the bird flu. Another virus is making the news. We're going to tell you what you need to know. And then finally, we got an update on a crazy plastic surgery death in Florida. This one's wild. We're going to talk about it, and it's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk. An honest and uncensored show about plastic surgery, health, beauty, and lifestyle. With your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. We really do appreciate it when you do that. I'm your host, plastic surgeon Dr. Bruce Hermann. With me, as always, is the awesome Sarah.
Hi.
Awesome Sarah. In the
How
box,
are
we
ya?
got Travis. What's up, buddy?
What's going on? How's it going?
It's going good, man. It's Friday.
Yeah,
Friday's
for
good.
sure. Friday is always good. It's always easy. Downhill from here.
I know, right?
hot
As I said,
outside, though.
it's what?
It's real hot outside.
Yeah, it is getting hot. Yeah, and also too, my wife's car's in the shop.
I know,
She's
I
got
saw
my
yours.
yeah,
The one
she's
with
got
no
my truck.
AC.
So I'm in the Blazer, which I was took it in to get the AC fixed, and it still doesn't work. So
That's fun.
it was spicy coming in, but not terrible, you know. Now, Sarah, you just were on vacation, right?
Yeah, I went on like a week-long road trip to the Grand Canyon.
Oh, how was it?
It was great.
Was it cool?
Yeah.
Have you been before?
No,
You've never been?
no. So I went and we saw like a bunch of different like cities and stuff along the way, and
Oh,
like
nice.
landmarks. So
And
it
did you
was
guys
really cool.
camp, or did you just have like a cabin out there?
No, I could not camp out there with my kid.
No?
It was so hot.
Oh, that's true. Yeah, it's pretty hot.
Yeah, so hot, and it was dry. It was gross.
Did you have like a cabin, or were you just
Mm-hmm.
doing hotels, cabins?
Yeah.
That's pretty awesome. Did you guys
Fun.
go down the river or anything, or?
No, it was just like whenever I took Avery, started taking her down the Grand Canyon, it just freaked me out.
Like
Like-
driving or walking?
Walking.
Oh,
You
okay.
can't drive down there. The only way to get down there
Oh.
is to walk or to get a mule.
Oh, really? How long does it take to walk down?
8 miles.
Huh?
8 miles.
It's 8 miles?
Yes.
Oh my God. Can you even like make that in like one
It takes
day?
all day.
So you go down,
there.
yeah, I guess you can make it. You can walk, what, like
You'd have to, you stay down there. Like
Three
you
miles.
hike to whatever, they have like cabins down there or campsites or
Really?
whatever. Yeah.
I have never seen the Grand Canyon. Have you ever been, Travis, to the Grand Canyon?
No, I've never been.
I feel like I need to go and just
Wild.
see it.
It freaked me out, and like a squirrel, like they're called rock squirrels, and they're kind of annoying and like people too much because they give them food, and the squirrel jumped on my leg while I was like literally standing by a cliff, and I
my
kicked my leg like that.
Did
and
the squirrel go off the cliff?
Yeah, screamed.
What? The squirrel screamed or
I
you screamed?
screamed, and then everybody looked at me like, "Oh my God, this lady probably just fell off the cliff," and I'm
Oh,
like,
God.
"No."
Did the squirrel go off the cliff?
Yeah,
Like off the cliff?
it was like rolling down.
Please tell me you have a video of that.
No.
Committed a squirrel murder.
Yeah, I'm surprised
at
you're
the
not like on
Grand Canyon.
TikTok.
I
Like,
almost got murdered.
like
That's crazy.
lady, like, kid,
and
well,
then
I
then
don't-
there was a sign.
Yeah,
that was
don't
like,
kick the squirrel.
Don't. No, it says do not interact with rock squirrels. And it was like and then like a park ranger was talking about it, and they were like, yeah, they are the biggest cause of human
like falls?
falls, bites, like just injury. These squirrels.
Really? Are they like
Yeah.
a regular squirrel? Or are they bigger? Or?
I think the reason they're called rock squirrels is just because they are the color of like the rock
Are they, like,
in the Grand
brownish?
Canyon. They're like light, and so they like kind of blend in. So I think
That's
that's
so
why
funny.
it freaks
That's
people
crazy.
out because they're just
I
like,
had no
hanging out.
idea this was a thing.
I
rock
didn't
squirrels.
either. It freaked me out.
Well, I
was
think
like,
it's
of
hilarious
course a
that-
squirrel
I
would
mean,
jump on me.
Not hilarious, but okay, it's pretty
a good
hilarious that like one
story.
jumped on you and you flicked your leg and it went off into the Grand Canyon.
It was like climbing up my leg.
oh my God.
And I was like,
I wish I had a video of
I'm
that.
just glad it didn't get on Avery.
Yeah, I know. She was like freaked out.
She would have freaked out. We've probably both been tumbling down the Grand
I
Canyon.
remember one time my wife was walking outside our house and we get these house geckos
Oh
and
my
like one of the geckos fell and it landed on her. I thought she was gonna scream, or maybe it fell on me. I can't remember. There was a gecko, and my wife was like going crazy. A
She was
squirrel jumped on
out
her.
of sorts.
Yeah, it'd be bad news. Yeah.
I wouldn't recommend getting jumped on by a squirrel or an animal of any kind.
Did they get rabies? Can you get rabies from these
I
squirrels?
don't know. But they were like, this is the leading cause of injury at the Grand Canyon is from these rock squirrels.
Yeah, wow, I had no idea.
Yeah.
Well, when I finally make my journey out to the Grand Canyon, I would
Stay away
definitely be
from
on
the squirrels.
guard.
I kept seeing them everywhere, and I was like, good devil.
Use some squirrel repellent.
Yeah.
Like the bear repellent.
Tell your friends I kicked one off the Grand Canyon.
That's pretty hilarious. I wish I could have seen that.
Not many people did. They just heard me scream.
Well, I'm glad you made it back okay. Sounds like
Thanks.
you had a good time overall.
Yeah, tons
All right.
of pictures. Good
Cool.
time.
You'll have to show me.
Yeah.
Definitely want to see them. All right, let's move on to some segments. So, starting off, I got a segment which it's actually really good. It's about something I'm not sure we've ever talked about specifically. It's kind of a lesser known topic. And this comes from a recent article I read about this breast surgery collaborative community, which is this collection of plastic surgeons and patient advocates. And they were talking about breast implant capsules and sort of the management of them. So, Sarah, I know you've talked about the fact that you have implants, so
Yeah.
I hope it's okay if we ask
Yeah.
you a question. So,
Sure.
well, I just want to make sure that you're still cool with it. So, if you were going to go and like have your implants out, like, would you know to ask about the capsule, or would that be something that?
No, I wouldn't know.
Yeah.
Is that a bad thing? It's a bad thing to have it, right?
No. So okay. So let me get.
Does your body like naturally create it? Or
Yes,
something?
that's
Okay.
right. Yeah. So whenever you put implants in somebody, or really when you put anything that's foreign in your body will realize that it's not you, and its response is to wall it off. Okay. And so when the object that's getting walled off is a breast implant, it's called the breast capsule. It basically is just this really thin fibrous layer which surrounds the implant, and it's actually good because it holds it in place. You have to be, one of the reasons you have to wear a sports bra right after surgery when you have implants is to kind of hold things in place so that the implants don't get out of position. And so once the layer forms around the implants, then you're all good, like it's not going to go anywhere. And so we want that breast capsule to form, that's good. But there is the question of if you remove your implants, like what to do with the capsule. And there's some varying thoughts on that. I think most good plastic surgeons are in agreement with this. And so I'm not sure we've ever talked about it. And so I just kind of want to go, I guess we haven't because you've been here almost as long as the show's been going on, and it sounds like that you're not familiar. So I guess the first thing is, okay, so who needs a potential breast capsule, surgery? Well, it'd be people who are taking out their implants, all right? And so I kind of lump those people into three groups. There's the people that just want their implants out because maybe they're, body changed and they're in a different time in their life and they just don't want to be as big as they are anymore. And so they want their implants out. And I see a lot of consults for that. I did a surgery like that this week, actually, 2 days ago. I do about 1 to 2 weeks, I'm taking out somebody's implants. And a lot of it's just people who've gotten older, like I said, people's body change with age and they gain some weight and their breasts get bigger and then they just don't need the implants. So they just simply want their implants out. The next would be the breast implant illness people, which is a pretty small percentage. I think the stated percentage is like 1% or less of people who get implants think they have breast implant illness. So not a huge number there. And then finally would be the breast implant associated cancer people. So that ALCL, it's like the anaplastic large cell lymphoma. Remember, that's only a risk when you have the textured implants, which are really, really, really rare in the United States.
Okay.
So there's three people potentially, or three groups of people that might want or might need something done with the breast capsule. And so I guess I should kind of go back to this breast surgery collaborative community, the BSCC. So like their statement didn't say a whole lot. I think I have Travis, throw up that picture. I think I have a picture of that little article that yeah, here you go. If you guys want to look it up, this is just their announcement as it was posted in the American Society of Plastic Surgeons, either website or journal or something. But if you want to look it up, that's what you would Google. And so like they didn't say a whole lot. And I'm always curious what these groups say, because a lot of times these groups say dumb stuff.
Yeah.
Like these groups, academics. I mean, there's a reason I'm not in academics. You know, sometimes they'll say stuff and I'm like, I don't know about that. But I will say that what they went over, I actually was in full agreement with. So the first thing they did is defined the type of capsule removal, okay? Because that's the question I was kind of getting or working towards when I was asking you about, you know, what to do with capsule. Because in general, you want to remove the capsule when you're removing your implants.
Yeah.
And
do people not?
Well, sometimes not. It just depends on the surgeon. You know, I would say most people do. I mean, most people are in agreement that at least partially removing the capsule is a good idea. And so I'll kind of go through like each individual patient and talk about, you know, like kind of how I feel about them. Because and like I said, me and this group I think are in pretty much agreement. So they define the types of capsule removal, and there's 3 kind of groups of capsule removal. So there's total capsulectomy, which means you remove the entire capsule. Right. So you're shelling the whole thing out of there, and that could be done as an intact capsulectomy where you take it out as one piece, or just a total where you take it all out, but it may not be in one piece. That makes no difference whatsoever. It doesn't matter if you take it in one piece or not. I actually do try to take them in one pieces when I can. Sometimes though it's hard to do because it's hard to get around behind it to free it up unless you pull the implant out. And a lot of times I try to take the implant out with it. And so sometimes it ends up coming out in more than one piece, but I do try to take it out one if I can, but really not for any reason, but just because. Then there's partial capsulectomy, which means you take out part of the capsule, but you leave some behind. And lastly would be an in-block capsulectomy. So an in-block capsulectomy means not only do you remove the entire capsule in one piece, but you also remove some normal tissue around it. So you're not just taking the capsule, you're taking some normal tissue.
Okay.
And so one of the things that really the main thing that they were talking about, the breast society, let's see, what was it? Breast Surgery Collaborative Community said is that the in-block capsulectomy should only be done if you're doing it for cancer.
Okay.
And I 100% agree with that. And so why would they say something like that? You're just like, okay, well, why was that the one thing they said? Well, because there are like these people out there that call themselves breast implant removal specialists, because they're basically preying on these people who...
Those 3 types?
Yeah, they're preying on people mostly with the breast implant illness because, you know, like nowadays everybody joins a Facebook group, right? And so like there's these Facebook groups that pop up for people that have breast implant illness, and a lot of people will get in their head they need to like have this done a certain way or their symptoms are not going to go away.
Right.
So there's these plastic surgeons that actually prey on these people, and like they, you know, they'll kind of tell them what they want to hear, and they'll say things like, oh, well, you know, I'm a specialist in implant removal, which is total BS. That's not a real thing. And they'll say you have to have like this total in-block capsulectomy to make sure that your symptoms go away. Well, I mean, there's been research on this, you know, on people that have breast implant illness, and there's no difference in outcome if you take the capsule or leave it. Like you can completely leave it in there, and their symptoms do not change one bit. Okay. And so, you know, and so, okay, well, why are these implant removal specialists saying that you need a total capsulectomy? Because it drives up the cost. You know, it makes it more expensive. And so, you know, once again, people are doing stuff for money.
I could see how it's like a big selling point. It's like,
yeah, right.
Whatever tissues has touched
exactly.
the implant,
yeah, see, you can
I'm going to take it all out.
Yeah, you can see how people would like buy into that. And then they'll say things like, well, if you go to a surgeon and they say they're not going to do this, then, you know, they don't know what they're doing.
Because it's unnecessary.
Yeah, right. It's totally unnecessary. I mean, and not only that, it's risky. I mean, when you start removing not just the capsule, but the tissue around it, you're really opening yourself up to some big problems. Things like bleeding, breast deformity, you know, draining fluid forever. You know, there's a lot of potential problems that can arise from doing an en bloc capsulectomy.
Yeah.
And so, that was kind of the main reason, I think, is they've realized that there's people preying on these people who are vulnerable, right? Because they feel like that they have this problem, and you know they're looking for someone to, you know, say, okay, yes, you have a problem, and you know, this is how you're going to fix it. And I do breast implant illness implant removals. I mean, I'm very like scientific about it. Like I will go over like all the current research and say, this is what the research says about if you have your implants out, you know, are you going to feel better? And this is what the research says about the capsules and blah, blah, blah. And I think most people are thankful for that. I've had actually 1 or 2 come in And after I like talked to them and went over all the research with them, like a couple of them decided not to take out their implants.
Yeah.
And
I
I think that they were, you know, happy with that decision. Versus if you go to someone who's an implant removal specialist, I promise you, you're not leaving there until your implants are out.
Right.
Because they're going to tell you, you know, they're going to feed into fears and whatnot. So I just want to kind of go over those 3 basic groups and talk about what I think about the capsules. Because I've been doing this forever now, and you know, I feel like I kind of got it down. And really, like I'm in agreement with like most of the people who are really, you know, good breast surgeons. So for your basic implant removal, like so say you decided one day, hey, look, I don't want my implants anymore. You know, I want to go smaller because I'm going to be like an ultra marathon runner or whatever. Of course, we'd take out the implant, and then I would take out your capsule in its entirety just by itself without taking any tissue. And the only reason I would leave any behind, and this is actually happens pretty commonly, is sometimes if the capsules are really good, they can be really thin and they're not like a really distinct layer. And if you try to shave that off muscle, like it ends up being a freaking mess.
Okay.
And so there are times whenever like, you know, I get like most of the capsule out, but there's parts stuck to the muscle. And I'm like, I'm just gonna leave it because it's so thin, it's not bothering anything. Usually I'll score it a little bit so that like it wants to react and heal down. And I just leave it. And there's no problem with doing that.
What do you do with capsules whenever people just get like them redone? Do you keep it or do you?
Yeah, you just keep it. Yeah.
And you stick the implant into the capsule, a new one?
The new implant?
Yeah.
Yeah, totally. Yeah, it's
Dang,
like a
I didn't
home
know
for
that.
it, right? It's like if you were gonna. It's like if you.
Interesting.
It's
so
like
if I got mine redone,
they would
you
just they would leave your
slice
capsule.
it open.
Yeah, they would
and
open up
stick
the
a new
capsule,
one in.
pull out your implant, and then if you were doing any alteration, you potentially would make cuts on the inside to open up the pocket in one direction or the other. Or if you're going bigger, then you'd open up in a few areas to make it expand.
It's like a little implant purse.
Yeah, exactly. I mean, the way I would think of it is like if you were going to, you know, if you're going to rebuild your house, you probably would use the slab.
Yeah.
Most of the time, you'd be like, oh, the slab's good. I just want to rebuild the house. So you'd knock the house down and you'd rebuild the house on the same slab, unless you were, you know, totally changing the design or whatever.
Yeah.
So yeah, there's no reason to like. And really, it's really to your disadvantage to mess with it. I mean, you know, I say this all the time that simple plans are good plans. And why in the world would you go and pull out a totally, you know, perfectly normal capsule? Now, if you have somebody that has like really old silicone implants that are ruptured, and you go and you take that implant out, that capsule is going to be garbage. Like it's going to be calcified, it's going to be hard, and in that instance, you're pulling it out entirely. You're taking the whole thing out and just letting it reform. But if I go in there and somebody's capsule is good, yeah, I ain't going to mess with it. You know, why would you? There's no point. If they had no problem, like why would you, you know, if it ain't broke, don't fix it. So anyway, for your basic implant removal, I mostly do total capsulectomies. I'll occasionally do like a subtotal where I leave just a small part of it because I think it's too much risk to take it out.
But is that muscle part, is that usually on people with like a lot of chest muscle, or is that just like
It just could be
one in a
anyone.
few? Okay.
You know, sometimes the capsule you can just like really peel it off the muscle very easily, and sometimes it's pretty stuck. And if it's stuck, then I'm not going to shave into someone's muscle to get a capsule out. There's no point. There's no benefit. So it's like, why do it? Okay, for breast implant illness people, I pretty much do the same thing as I do for regular implants removal.
Yeah.
I try to take out the entire capsule. And so I guess the question someone might ask is, why do you take it out at all? Well, I just feel like that things heal better if there's a fresh layer to heal to. The capsule is kind of fibrous, right? And so
What happens when you leave a capsule in though?
like most of the time, if you just open someone up and you just literally took out their implant and closed them immediately, the risk would be is those layers wouldn't heal together. And you might get fluid buildup in there, or there might just be this permanent space in there. Typically, any tissue that sticks together will eventually heal to itself, but I feel like that you should pull the capsule out to get a nice fresh layer to heal to yourself, because that'll heal very quickly, and there's not any risk of like fluid collecting or anything like that.
Sounds like it shouldn't be in there.
I've seen people, like, I remember when I was in training, and there were plenty of surgeons that when they did implant removals, they would just pull the implant out and that would be it. They wouldn't do anything with the capsule. And really, like, I don't think that there's a lot of data to show that there's like this, you know, really bad complication if you don't pull it out. I just tend to pull it out because I want to make things anatomic if I can.
Yeah.
I don't want to leave something in there that wasn't there initially.
Yeah.
And then lastly, for the implant-associated cancer, the ALCL, and I actually have treated one of those patients, which is pretty rare because, you know, there's not that many of those cancers in in the United States. I think it's like a few hundred. Like it's not a big number, which I actually diagnosed one like many years ago, like when it was kind of like an unknown thing. So you do want to remove the capsule and some healthy layer. It's like any cancer operation. You don't just take the cancer out, you take some normal tissue with it. So that'd be the only time like an en-bloc capsulectomy is really kind of needed. So, but yeah, so that's kind of the info on breast capsules. You know, I think that there are surgeons out there that are taking advantage of people that get into these groups and feel like they have to have like a certain type of capsule removal. Like all the data shows that's not true.
Yeah.
You know, I do think it is a good idea to remove the capsules, but you know, I think it should be done in a smart way and not take extra tissue unless it's for cancer, which is very, very, very rare that happens. And you know, finally, I think that you just have to be aware of these like gimmicky marketing people. You know, like people that say I'm an implant removal specialist. That's not a thing. You know, if people are gonna like be shady like that, then you know I'm not really sure I would trust them. Yeah. You know, I mean, it's better to just go somebody who does lots of breast surgery, and you know they'll be more honest with you, I think. So, anyway, capsules. So now you know, right?
Yeah, I know. I didn't know a lot about it.
I mean, if you were going in as a patient and you're having your implants removed, I think it's definitely important that you ask your surgeon, what is your plan with the capsule, just so you know. Because if they're going to do something crazy like remove the whole thing, they may try to charge you for that. I typically, you know, I really don't charge for people for capsule removals unless they're bad. Because it can take an hour to remove a bad one. If it's like really scarred in, I mean, it can add like an hour of surgery time. So that does, you know, but for the most part, I don't generally charge people to remove them. Yeah, I just do implant removal. It's like one fee.
Nice.
Yeah, so, all right, capsule removal. Now you know.
Capsules.
All right, capsules, good. All right, speaking of need to know, this is a topic that people probably are not going to want to hear about. So in the past month or so, I don't know, have you seen a lot about the bird flu? You haven't?
I haven't heard anything about it at all.
Travis, have you heard about it?
Yeah, I have.
Okay, all right, so I'm not the only one. All right, so in the past month, I've seen a lot of stuff in news articles and social media talking about bird flu. And I've heard of bird flu before. I mean, it's not new.
I remember that was popular whenever I was like in middle school.
It's popular. Bird flu's coming back.
Yeah, it was like when George Bush was the president.
Yeah, so yeah, we'll talk about that. So yeah, I kept seeing these articles, and at first I was just like skipping past them because I mean, I feel like I still have pandemic fatigue. Like just the thought of like another pandemic coming, I just can't take it. Like the thought of like lockdowns and masking and distancing, like I'm out. And so like when I kept seeing these articles, like no, not again. I can't take another pandemic. But eventually I was like, okay, well, you know, I really have this like belief that like knowledge is power. I was like, okay, I'm gonna like dive into this and see why are people even talking about bird flu right now. Do you guys know anything about bird flu?
No, not really.
I don't know a lot about it. No, I know. I think I had heard that there was some cases. There was a case at least in Texas.
That's true, Travis.
Yeah, right.
Yeah, look at you, man. You're on the ball. All right.
For sure.
All right. Well, I'm gonna get you guys up to speed on bird flu so you can press all your friends
right
tonight
on.
at the bars or wherever it is you might be going.
Let's do it.
Okay. So, all right. So unlike COVID, which the very first COVID-19 case was in 2019. That's why it's COVID-19. Bird flu's been around for decades.
Yeah.
They've been documenting cases in humans for over 30 years. But the one big difference between COVID and bird flu, so COVID infected like close to 1 billion people in 4 years. Bird flu in over 30 years has infected less than 1,000.
Yeah.
So that's good, right? I mean, if we're talking about like a new virus, it's been around for a long time and it's not really infected a lot of people. So that brings up the question is, why are humans not getting this virus?
Yeah.
So I kind of dug into this. So H1N1 binds to a certain type of receptor that is very, very prevalent in birds and some animals, but it's just not really prevalent in humans. It's like the same thing with the COVID that bound to the specific receptor in like an airway tract. The one that's the bird flu binds to, we don't really have.
Okay.
I mean, some people have it. It can be in there, but in general, we have very low numbers of these receptors. So that's the first thing. The second thing is that the human immune system is very, very protective against the viral replication of bird flu and protective against it spreading from cell to cell.
Okay.
And so I didn't go in so deep a dive to go into the molecular biology of it.
Yeah.
It just says that our immune system has certain protections against the replication process.
Maybe it's learned.
I don't know. It's I probably should have looked it up, but like, you know, you can get really deep into that stuff, and it's just like, okay, most people, they're just like, okay, it doesn't. They just want to know.
It doesn't do what it's. Yeah, it's not good at its job.
It's not good at it, right? That's all they want to know. So those two things, the fact that that we don't have the receptor specific for it to bind and get into us, and the fact that our immune system actually is pretty good at preventing it from replicating, is a really good reason why in over 30 years there's been less than 1,000 cases. Another big important thing that's good for humans when it comes to bird flu or H5N1 is that it's almost always a dead-end infection. Have you heard that term, dead-end infections?
No.
All right. So a dead-end infection means that it's very, very unlikely that if you get a certain infection, you're going to pass it to somebody.
Okay.
So like the complete opposite of that would be something like measles or COVID, where
so it's not contagious from human to human?
Yes.
Okay.
Yeah. And so there's actually a very specific reason for that. The H5N1 viral particles do not build up in respiratory secretions.
Okay.
That's the big thing with like the common cold and regular influenza and coronavirus. Like the viral particles build up in your saliva, and so when you cough and you sneeze, or even like when I'm talking here, you know, there could potentially be viral particles coming at you. For whatever reason, the H5N1 does not build up in the respiratory secretions, and so that's the biggest reason that in humans it's kind of a dead end infection. Unlike animals that are always kind of touching each other, you know, they're very commonly either eating from the same thing or you know, like having close contact with each other, and that's how they pass it. So it seems that, you know, when people do get this infection, they're not getting it from, you know, like if you come down with bird flu, you didn't get it from me or yeah, right. You got it from an animal.
Yeah.
You know, and so then that always brings up the next question is how prevalent is this, you know, in the United States? Like, you know, is there a lot of bird flu around?
Yeah, who got the virus? Was it like a bird keeper?
So that's a great question. So actually,
zoo worker?
it was actually a kind of spoiler we're gonna talk about in a minute, but like it was actually two of them were dairy farmers because it's now spread to cows.
Yeah.
So this was kind of surprising when I was looking up bird flu. I was like, oh, bird flu, you know, maybe some birds have it in the United States. So the CDC says that in wild birds, that bird flu is widespread in all 50 states. Like it's very, very prevalent. In poultry farms, there's sporadic outbreaks in 48 of 50 states.
Oh my goodness.
It's pretty wild. And now there's an ongoing multi-state outbreak in dairy farms. The cows are getting it in 10 different states.
I know birds like to hang out on cows' backs.
Right, exactly. Yeah, that's how the animals are like passing it back and forth to each other. So there's these widespread bird flu in wild birds, there's sporadic outbreaks in poultry farms, and then there's a current multi-state outbreak in dairy farms. This stuff is actually pretty prevalent. You know, it's out there. So the good news—
Is there a vaccine?
There is a vaccine, actually.
For animals?
I don't know if they're giving it to animals. I know that there's a vaccine because I just saw that.
I know there is one because my mom was a nurse, and I remember when it was like that first big like.
Oh, so it's been around a while.
Thing.
I thought it was new because I saw that either the Netherlands or Norway or one of those little.
Wasn't it called? I thought it was called H1N1 back in the day.
There is an H1N1.
That was the first. That was the one my mom was always talking about.
Okay, so this is H5N1.
Yeah.
That's the current one.
Yeah.
I guess, is H1N1 bird flu also?
I thought it was.
Is it? Trellis?
I don't know.
I thought H1N1 was something else. Maybe I'm wrong.
Isn't that swine flu?
Yeah.
Oh, okay.
Yeah.
My mom's. She was always talking about some virus or
it's swine
some
flu.
type of.
Swine flu.
It
Okay.
is swine.
Hey, that's another. That one's probably.
Did I tell you guys the story about how swine flu originated in Mexico?
Mm-mm.
Yeah, so it originated in Mexico, or at least one of the big outbreaks did. So back when my wife and I didn't have any money, during the middle of swine flu, like we took a vacation to Mexico.
You did tell me about whenever you were younger, you went to Mexico,
like
but I don't think you told me why.
Yeah, well, because it was the middle of the swine flu. Like, there was like 0 people on the plane. Like,
Okay.
It was like empty, and like the resorts were at 5% occupancy. It was awesome. We got the whole trip for like nothing,
Nice.
and we did get swine flu.
Nice.
And everyone thought we were mad. Like our friends just thought we were bonkers.
Yeah.
But anyway, okay, so I lost my train of thought. Oh, so the good news. All right, so so there's a lot of swine, and there's a lot, not swine, there's a lot of bird flu in the United States. It's in wild birds, it's in like poultry farms, it's starting to get into other animals. Like people were talking about foxes getting it, and of course dairy cows. So with all these animals getting it, there's only been 4 documented cases of humans in the United States. And 2 of them only had conjunctivitis. It didn't even get into the respiratory system.
Yeah.
Yeah.
It was in their eyes?
Yeah, it was in their eyes, yeah. They probably got splashed with like raw milk at the dairy farm or something.
Gross.
Yeah, that's pretty gross, right? And so what's interesting is of those 4 people, all of them made a full recovery and none of them had any type of serious symptoms. And so here's the interesting part on bird flu. So when I was looking up the mortality rate for humans, like the stated mortality rate says 50%. Like that's crazy high. I mean, crazy high.
Is it just because like people, they're like, oh, I don't know what you have?
I think you're 100% right. I think that the reason that the mortality rate is stated to be so high is that the only people getting tested are people that are like really sick, and they're not sure what's wrong with them.
Yeah.
So probably there's way more than 1,000 people that have been infected in the world, and I think a lot of people, just like these people in the United States who had very mild symptoms, just had very mild symptoms, and they never went and did anything. So I think it probably is actually more prevalent than.
Yeah. And then honestly, if it's people that mainly work with animals, you have to think about if they take off from work, it's like that's detrimental to them.
Like they're not taking off work.
Yeah.
They're not going to the doctor.
Or they're like, and it sounds like, I mean, most people that work with animals are dudes, and dudes don't like going to the doctor.
Right. Well, and also too, a lot of the I looked at like where the deaths occurred. I mean, a lot of it's like third world country as well.
Yeah.
And
so
they
don't have access to anything.
Yeah, they don't have access to care, and so I think that 50% mortality rate, because I was like, this can't be right. There's no way that this is 50%. I mean, that's like Ebola levels.
Yeah.
That's like insane. Like if there was a pandemic with a 50% mortality rate.
What's the mortality rate for the animal?
That's a great question. I'm not 100% sure. I think it's fairly high in birds, but not in mammals.
Okay.
That's a good question, sir. I didn't actually look at that.
I feel like
I'm going to look that up.
I feel like they vaccinate animals, like farm animals?
Yeah, but do they vaccinate them for bird flu?
I feel like
so.
that's something they should, if it's like.
I don't know the answer.
If that's where it's coming from.
I'm not sure. Maybe
it's kind of hard to vaccinate a wild bird, but
yeah, a bird we can't. But
farms with chickens and cows and your horses and all.
Yeah, that's a good question. I don't know the answer to that. I will look that up if they're I'll look up what is the mortality rate of bird flu in birds, and I'll look up are animals getting vaccinated for bird flu.
Yeah.
I don't think they are, to be honest.
I mean our dogs. I've never gotten a vaccine for my dogs for it.
For bird flu?
Yeah.
No.
Yeah, I'm saying
it's like rabies
it's like
and
for
distemper.
farm animals though.
Yeah, I'm not sure. That's a great question. I know a vaccine exists because they were talking about countries buying it. Yeah, good one. I'll have to, and also I'm curious what the mortality rate is in the birds. I mean, there's still birds out there, so obviously like the birds aren't all dying. I mean, I see birds.
We're gonna have zombie birds.
I know, it'd be bad. But yeah, I think that high mortality rate that's stated is just due to the fact that they're only counting like the really sick people, like the worst cases, and then it's also third world countries. So how do you avoid bird flu? I mean, this is pretty easy. Don't mess with wild birds. I mean, it's a direct contact thing with humans. It's not like, it's not like secretions or coughs or sneezes. Like you grab the bird and you hold it and then you rub your face. So avoid wild birds, sick birds, also, farm animals that are sick.
Yeah.
I mean, it should be pretty easy. And also avoiding raw milk, because apparently it can get passed in milk. It's in it viral sheds into the milk. So I guess the final question that, that needs to be answered is, do you need to be worried about bird flu? Like, is this the next thing?
No.
I mean, in order for bird flu to be a problem for humans, it would have to go through some serious mutations.
Yeah.
Because there's a lot of things that make humans not as susceptible to it. Mm-hmm. And it is technically possible that it could mutate and that could be a problem, but is it likely that all of those things are going to mutate? No. I mean, I think if it mutated once and then suddenly, okay, well maybe it still isn't built up in secretions, but now it can enter through another receptor on humans. Okay, it's like, whoa, that thing's changing. We need to be a little bit more, but it still has the thing where it's not easily transmissible because that doesn't build up in the secretions. So, if it mutated one thing, it might be a little bit more, but there's a lot of things about it that make
work.
Don't work with humans. Yeah.
Yeah.
So anyway, but it's good to know about it, right? Because now,
Yeah.
now when you see these articles, you're like, oh, okay. All right, so I think I'll recap this one. This is a pretty interesting topic. So today on Nip Talk, we were talking about bird flu, H5N1, because I've seen a lot of articles about it lately. And of course, you know how the media is. Sometimes they want to, shock people or scare people. So I did a pretty deep dive on bird flu. I have to say I wasn't 100% familiar with it. So bird flu is very prevalent in the United States, mostly in wild birds. There are some outbreaks in poultry farms, and there are some outbreaks in actually dairy farms. But the good thing about bird flu for humans is that we have some very protective factors about us that make it very hard for us to get bird flu. The receptors that it binds to, we typically don't have. Also, our body is very good at preventing replication, and also bird flu doesn't build up in secretions, which is the way humans transmit lots of illnesses. And so in humans, it tends to be a dead end infection, meaning that if a human gets it, that's usually where it ends. So yeah, I don't think that we need at this point to get really super scared about bird flu. It would have to go through some serious mutations to be very potentially harmful to humans. It does have a pretty high mortality rate as stated in humans when they get it, but I think some of that is that they're only counting the most serious cases, because the 4 documented cases we've had in the United States, everybody fully recovered with only minimal symptoms. So I think it's good to know about bird flu, but should we be afraid of it? At this point, I don't think we need to be. So
Nope.
no. Sarah's just like, no, I'm not
No.
going to be afraid of bird flu. All right, let's move on to the last one. Now, Sarah, I know you love a good Florida plastic surgery
Love
story.
some Florida tea,
Yeah.
plastic surgery tea.
So I actually looked this up. So we talked about this. It's been about a year and a half. I'm asking if you remember this. Do you remember the plastic surgery? And there was this, unfortunately, this patient died where the anesthesiologist was like not an anesthesiologist. Do you remember that one?
Yes.
Okay.
I think so.
So this is that one. So for the people who, I mean, it's been a long time, Sarah, and we talk about a lot of like bad surgery outcomes. So I don't blame you. I vaguely remember once. I was like, I think we did a segment on this. This was, so I'm gonna recap this for you. So this was a 26-year-old patient that was having a Brazilian butt lift, which I hate Brazilian butt lifts. I don't like them.
Florida.
Yeah, it was in Florida. And she was having a breast augmentation as well, and this happened in 2021. Surgeon was Dr. John Neese, and the anesthesiologist was Dr. Millicent Muir.
It wasn't an anesthesiologist.
And it wasn't an anesthesiologist, right. The anesthesiologist, or the person acting as anesthesiologist, was an OBGYN. And they were doing, and I hate this so much, they were doing this pretty major surgery without general anesthesia. So they were doing it under local with sedation, which I hate. And it was supposed to be a level 2 conscious sedation, which means that they sedate them, but they're still awake. But apparently, according to the log, the patient got as much drugs as to be a level 4 sedation, which is like one of the absolute highest. I don't know if it's the highest. I don't think so, because it's not paralyzed. But like for level 4, like you need to be intubated, meaning have a breathing tube, and they didn't have that. And so the patient ended up suffering cardiac arrest during surgery and never recovered, and unfortunately passed away. And so we talked about, it was just so crazy that they had an OBGYN of all people acting as the person giving, the anesthesia. And to be fair, like they didn't actually put the person under general anesthesia. The reason they didn't intubate him is because an OBGYN would never.
Know how to do that.
They wouldn't do it, right?
Yeah.
They would never do that. They were just there to push the drugs, and but like the person wasn't apparently super skilled at it, because the patient got way more drugs than they should have, which probably was a factor of them being uncomfortable in surgery. That's probably why they gave them more drugs, to make them comfortable so they could pull off the surgery, and then they got too many drugs in there, and they went in cardiac arrest, probably from hypoxia. They quit breathing, and the patient died. Yeah. And so here's the crazy part. So this is the update. So this is kind of bonkers. So Dr. Muir, who is the OBGYN, who is the acting anesthesiologist, has lost her, I think it was female, Millicent. Yeah, it was her. Lost her license to practice medicine.
Good.
Yeah, I mean, it is good, because I think that, if you're an OBGYN acting as an anesthesiologist, that you're potentially opening yourself up for trouble. But what's crazy is Dr. Neese, the surgeon, who is overseeing he was supposed to be overseeing Dr. Muir and making sure that Dr. Muir was not doing more than she should have, is not lost his license. Now, how does that make sense? Now, there is an inquiry. He does have an inquiry into him, which means that they are looking into it. But as of right now, this guy's out there operating. But the person that he was supposed to oversee and actually
hired as an anesthesiologist.
to make sure that the patient, was able, got safe amount of drugs.
They're both morally unsound, for sure.
Yeah.
They don't.
And this guy, Dr. Neese, has had some other disciplinary actions in the past. Nothing like, earth-shattering, but there's been a few things. But yeah, so I want to comment on this one. And I want my people, like my marketing people, to clip what I'm about to say, because this is super important. If you were thinking about having plastic surgery, and you're thinking about having major plastic surgery, absolutely have general anesthesia. Like doing this under local with sedation is just a very, very bad idea. Now, I've done some small stuff myself under local with some light sedation, like really small lipo. I actually did a couple of breast dogs under local with some sedation, really just to see how the patients did. But I did it in an OR, which was a little bit different than a lot of times these are done in the office. They went okay, but like I just wasn't a fan of it. Nowadays with anesthesia being so safe, there's just no reason not to go under anesthesia if you're having major surgery. It makes it so much safer, because I can almost guarantee you that what happened in this case, this patient was having major surgery, which I would never attempt to do what they did under local with sedation. And the patient either was uncomfortable and they pushed too many drugs, or another thing that could happen is they had to give so much local anesthetic, the patient went in cardiac arrest from that. There are just so many bad things that can happen if you have major surgery without general anesthesia, or without at least an anesthesiologist there to oversee it. And this happens all the time in the United States. I know a patient I just took care of that went to one of those places, these plastic surgery mills here in Dallas, and had a really bad outcome. And it was the same thing. She did it. It wasn't general anesthesia. She got hypoxic during the case, and luckily she didn't die, but she had a really bad outcome. And I just see this time and time again where people try to get these big surgeries without general anesthesia, and something bad happens.
Yeah.
So
it's like always usually the first red flag of any of these stories.
Right. Yeah, it is. I mean, and I'm not saying it can't safely be done, but it just opens you up to so much risk. I mean, the people who are doing it are, the reason that surgeons are doing it is because they're trying to make it very, very cheap, or they're shady enough that like no anesthesiologist will work with them. I mean, that does happen because that happens a lot when it's like non-plastic surgeons doing it. Like they're not going to get someone that's going to agree to put a patient to sleep, so they do these conscious sedations.
Yeah.
And this guy actually was a board certified plastic surgeon, but I think he was at one of those plastic surgery mills. That's why they did it that way. It's just not as safe as it could be.
Right.
And it is surgery, and these are major surgeries, and so you're just putting yourself at risk. So if you have friends or think about going to plastic surgery, I'm so against doing major surgery without general anesthesia.
Yeah.
It's just, you want to be safe. Like, it's not worth your life, or having like a horrible complication and then having to pay all this money afterwards. So I think probably eventually this guy is going to lose his license.
I would think so.
I mean, that's pretty egregious. Like, I personally would find it to be malpractice what they did. To do that big of a surgery under light sedation is just, it's unsafe. I would totally, I personally would testify against him.
Yeah, that's crazy.
Yeah.
He should find a new job.
It happens a lot. I mean, it happens more than you think.
Yeah,
so.
he should take this time to find a new...
new hobby, new career.
New career, for real.
All right, well, if I have any more updates on that, I'll let you know. So I think that's all we have time for today.
Thanks. That's some spicy tea.
Spicy stuff today. All right. Well, it's good to see you guys. I know we had a couple weeks off. It's good to be back. Get back into the swing of doing topics. If you like these segments, please leave us a comment and let us know about it. And also let us know if you have anything you want us to talk about on the next episode of Nip Talk. Bye.